I'm a research scientist and a member of the Jain Health Initiative. On behalf of One Jain, I welcome you to today's event. Before we start, please join me as I recite the Navka mantra. Om Namo Arihantanam Namo Siddharam Namo Ayariyaram Namo Vajayaram Namo Loye Savasahunam Eso Panchanamokaro Savapavapanasano Mangalanancha Sarvesim Padamamahavai Mangalam Padamamahavai Mangalam Namo 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 Namo. Today's webinar tackles the subject of mental health, and we're really fortunate to have with us today 4 highly qualified expert speakers who are going to help us navigate this vast and often misunderstood area of health. They will address the following questions. What is mental health and why do we find it so difficult to talk about? What is well-being? What are the mental health conditions? And finally, and most importantly, how do we get help? How do we help others? And how do we stay well? After our speakers have given their presentations, we're going to have a question and answer session where your questions will be put to the panel. So if you have any questions that come to your mind while you're listening to what they're saying, please do write them down in the comments section, which is just below your screen on the YouTube video. Our panel will try their best to answer as many questions as possible. As long as the questions are general in nature and involve general advice. However, they will not be able to give personal clinical advice. So let me introduce our first speaker to you today, and her name is Varsha Dodhia. For many of us who live in London and who are within the Oshawa community, Varsha is a really familiar face. She actively participates in community and religious events, and you always see her with a big smile on her face. However, you may be surprised to know that in her day job, Varsha works for the Central and North West London NHS Trust as a service improvement manager, and specifically within the mental health and community area. She also plays an active role in the Harrow Clinical Commission Group, also in the Harrow Council and the North West London Integrated Care. Varsha has many hats, so she's also an NHS lay partner advisor, a dementia and elderly care champion and a qualified teacher. Finally, welfare of children and young people is very close to her heart. So I'd like Varsha to please open our event for today and give a general introduction and overview to mental health. Over to you, Varsha.
Hello, good evening, everyone. Today we're going to talk about it's okay not to be okay. Today's talk is around mental health.
Sorry, Varsha Ben, can you just put it on slide view for us, please?
Thank you very much. Apologies there. So today we're going to talk about it's okay not to be okay. We're going to talk about mental health. Firstly, what's mental health? To do with our minds, our thoughts, emotions, feelings, and behaviors. And you can't have a healthy body without a healthy mind. And one doesn't function without the other. So it's really, really important if we look at holistic health, that we look after our mental health as well as our physical health. So here's a few questions. Have you been ever irritable, been less confident than usual? You tend to sleep or just feel you haven't had enough sleep. Sometimes you get into a phase where you talk too much and then your thoughts are really, really racing in your head and you have no energy. You just feel lethargic. And at times you spend money and you get trouble as well. Mental health. It's not that unusual, it's really common. So in a year, you might find 1 in 4 people who have a mental health condition. And as generally people say, during your lifetime, 1 in 4 person will have a big mental health condition. The most common are depression and anxiety. Some mental health problems, serious mental health problems, start when people are young. And from ethnic minority communities, we are less likely to even go and talk to our GP, let alone go and talk to a psychiatrist. So studies indicate that as South Asian, because most of the data is collected as South Asian, we underutilize the mental health services. So when I was at Hillingdon Mental Health, there were very few people who would really access services. So why do we find it so difficult to talk about mental health? Why is there such a stigma around mental health? Shame, fear, secrecy. Really, these are the driving things, that really gets us not to even open up. Amongst our communities, mental health illness is really, really misunderstood. Sometimes our families can be caring, but sometimes in trying to just cover up and not talk about it, it can feel really isolating. You just feel, you know, the family becomes kind of sometimes a burden, sometimes it's really good. If you are at Navnat Center or Oshwal Center, I don't think anybody would actually really discuss about mental health. There's so much social pressure to conform. And can you imagine if you have a mental health condition and if people find out, you really feel not valued? People use words like gandoche, after psychoche. And worst of all, you know, even at work or whatever, if you are suffering a mental health condition, we cover up, we never talk about it. We don't talk about our relationships because this can be really challenging. Can you imagine your mom thinking, छोकरा ने હવે દીકરી કોણ આપશે if he has a mental health condition? So for the older people who are listening today, sometimes we say Adi, Vyadi, Neupadi. So Adi is about mental anguish. Can you imagine that person really holding on, you know, trying to do just manage day to day when they are really, really struggling. And Vyadi, maybe in our families, we do know that one of our family members is really struggling and we worry about them. Um, and then there are times where we feel constrained because we don't know what to do, how to help them. Now, I'll give my personal example that when my son was doing the cycle ride from London to Beijing, he was picked up. He was actually arrested by the Iranian authorities and he was held for 4 days. When I found out from the British Embassy that my son was held, I actually lost sleep. I couldn't sleep. And I think today is Mother's Day, so mothers can really empathize with that. That, when your child is in trouble, it's really, really difficult. And at that time, it's so difficult that he's halfway around the world, and I had really constrained. What can I do? Will he be okay? Will they mistreat him? So many thoughts just kept racing in my head. So I would say if I was in this situation again, I would share it with somebody. A problem shared is a problem halved. And I'd like to share that people who are in public life do suffer mental health conditions. Winston Churchill, he used to call his depression mad dog. So can you imagine when he was the Prime Minister of the United Kingdom, holding the highest office in our country, he was plagued by depression. Both Anushka Sharma and Deepika Padukone have talked about their anxiety. And you saw a little clip at the beginning of Shah Rukh Khan really sharing, how it's so difficult in our communities as South Asian, as Indians, that we just don't talk about mental health. We know Princess Diana, she had an eating disorder. And very recently, Freddie Flintoff, one of our really well-known cricketers, he came out talking about his eating difficulties, disorders. And for me, my Mork and Mindy, Mrs. Doubtfire, Robbie Williams, he had a real deep mental anguish, had a depression. And even though he kept a very smiley face, he, in the end, couldn't handle his mental health condition. So for me, there's no help without mental health. If you have good mental health, yes. So today I'm going to dedicate two people who really brought me to this mental health journey. And one is Chandubai Shah, who was a governor at Central and Northwest London Foundation Trust. And he had a son, and he always openly talked about mental health. And he championed the time to change. And the second person I'd like to dedicate today is for Anup, who really challenged my own concepts and understanding around mental health. Thank you for listening to me.
Thank you very much, Varsha Ben, for giving such a wonderful overview. So Varsha Ben, if you can put off your screen and your mic, we're going to go over to the next speaker. Our next speaker is going to be Anish Shah. And Anish is going to answer the question, what is well-being? So I want to tell you a little bit about Anish just before he starts. Anish is the founder of Mentis, a new mental health non-profit organisation. But by background, he's a qualified counsellor and a social worker with 18 years of experience in the health and social care sector. In his previous position, he was a director of a mental health charity in East London. Anish's main area of expertise is working with clients who suffer from depression and or anxiety. Anish is passionate about using a more personal approach to mental well-being and offering an all-encompassing model of therapy and mental health support to his clients. So Anish, over to you. Please tell us about well-being.
Hi everyone, Rajvee Ben, thank you very much for that introduction. And to everyone, as Rajvee Ben has mentioned, my talk, my presentation is going to be about what is well-being. So, if you do a Google search, you'll find a number of definitions for well-being, some of which are quite similar to each other, and some of which are quite different. However, despite these various definitions, defining well-being is actually a personal journey. And in terms of this personal journey and defining well-being for yourself, the simple question to ask is, how do I want to feel? And in terms of how we want to feel, the main things that will come up for us are things like feeling happy, feeling satisfied, feeling content, and feeling fulfilled. But whichever words you choose to use, at the core level, well-being is about feeling good in yourself. Now, to help you identify how you want to feel, there are three ways of doing this. One, either you can think back to a time when you felt good in yourself, if you're currently struggling with how you're feeling. Two, if you've never really felt that great, then it would be about thinking how you might like to feel going forward. And finally, if you're generally feeling good, you might then want to think, what could I do to maintain this? Once you then have a sense of what well-being looks like for you, it's then about understanding what are the factors that influence well-being, and ultimately, what are the factors that determine how we feel. So, at the broadest level, well-being and how we feel in ourselves is a combination of two things. Firstly, there are internal factors, and internal factors refer to how we think about things and what are the thoughts that we have about the different areas of our life. In addition, they also refer to the behaviors and actions we choose to take across the different areas of our life. There are then external factors, and external factors refer to our life circumstances and our external environment. So essentially, this is about what is going on around us and how this influences our well-being. So to give everyone more of an idea about internal and external factors, I'm firstly going to go through an example to demonstrate how internal factors can influence our well-being. And I'm then going to give an overview of some of the main external factors that can impact on our well-being. So in this example about internal factors, I want you all to imagine that two people who are called Prakash and Priti recently went for a job interview. And Prakash and Priti, around a week later, receive a letter in the post to let them know how they did. When they open up their letters, they both unfortunately find out that they haven't been successful. And naturally, as you'd expect, they both feel disappointed. Now, in terms of how they handle this disappointment, Prakash goes through the following thoughts. Number one, I must have been so useless in the interview for them to reject me. Number two, I'm never successful at anything. And number three, what's the point of applying for another job anytime soon? It'll probably end in failure anyway. Priti, on the other hand, thinks some very different thoughts, and her thoughts are as follows. Number one, while it's a shame I didn't get the job, it's good that the company provided a number for me to contact to get some feedback on my interview. I'll definitely call them to find out where I did well and where I could have done better. Number two, I've experienced success on a number of different occasions, so there's no reason why I can't be successful in the future. And number three, once I receive the feedback, I look forward to learning from this and applying for another position as soon as possible. And in terms of the actions they both take to alleviate the feelings of disappointment, Prakash decides to drink a bottle of wine, eats a whole box of jalebi and gathia, and he then passes out on his sofa. And later, he wakes up feeling exhausted and demotivated. Priti, however, remembers that there's a new yoga class which has recently started at her local gym, and that she's been meaning to try it out. She sees today as the perfect opportunity to do this, and she attends the class, and at the end of the class, she feels invigorated and energized. Now, from this example, it's probably clear that Priti will get to a place of good well-being much more quickly, whereas Prakash will find that his well-being suffers, and if he's not careful, he could end up spiraling down into a place of low mood and depression. So hopefully this example highlights how important our thoughts, behaviors, and actions are in determining our well-being. And just before we leave this example, the reality is we're all, of course, human. And when we're faced with a difficult situation or receive some bad news, we'll naturally go through some of the types of thoughts and behaviors that Prakash did. But the key is to try and respond to challenging situations in a similar way to how Priti did. And at this point, it's worth me mentioning that the cornerstone of the work that I do and other mental health professionals do is to help people move away from destructive thinking patterns and patterns of behavior to more positive and constructive ones. So I'm now going to go through some of the main external factors which can influence our well-being. And these are family and social networks, education, work, and finances. And what I'm going to do is talk a bit about how each of these factors can either have a positive impact on our well-being or a negative one. So firstly, with family and social networks. If you have family and friends in your network who encourage you to achieve your goals, supports you through any difficulties, and respect your point of view, even if it's different from their own, then this will have a positive impact on well-being. If, on the other hand, the people in your family and social network ridicule your ambitions and constantly tell you you'll never achieve what you want to do, ignore and reject you when you're going through a tough time, and get angry at you when your point of view differs from their own, then this would have a negative impact on well-being. Education. An educational institution which would positively impact on well-being would be one where teaching staff explain the subjects in a clear, interesting, and easy to understand way. There's extra support available for students who are struggling, and students are friendly towards each other, and there is a culture of inclusivity. If the opposite existed and teaching staff are demotivated and can't engage students properly, there's either no or extremely limited extra support available for struggling students, so those same students fall even further behind. And where diversity of any sort is not accepted, resulting in a lot of bullying and aggressive behavior, this would all more than likely result in a negative impact on well-being. In terms of work, a job which is enjoyable and rewarding, where you're paid fairly, where the workload is manageable, and staff at all levels communicate openly with each other, will have a positive impact on well-being. If, however, the job is mundane, the pay is substandard, workloads push staff to the limit, and there are significant office politics where colleagues are dishonest and two-faced, this will all negatively impact on well-being. And finally, finances. A financial situation which would have a positive impact on well-being would be one where there are enough funds to comfortably afford not only the basic necessities, but also a decent proportion of those products or experiences which are personally meaningful and memorable. On the other hand, if basic expenses and necessities are always difficult to afford, saving is practically impossible, and there's barely any money left over for even occasional luxuries, this type of financial situation would adversely impact well-being. So, in terms of what we can do, where our thoughts and actions adversely impact our well-being, generally psychological solutions such as therapy and self-help books and videos can be immensely helpful. In addition to psychological solutions, and especially because this webinar is part of the Jain Health Initiative, I also want to mention spiritual and faith-based solutions. And quite simply, all this means is that if practicing your faith and spirituality helps with your well-being, don't let anything stop you from doing this to the maximum. Now, if our life circumstances and external environment are negatively impact on our well-being, it is generally the practical solutions that are most effective. So if we take the example of sudden job losses, which so many people have suffered as a result of the COVID pandemic, understandably leaving them feeling depressed and anxious, some practical solutions which would hopefully help could include help with updating one's CV, retraining if it's better to move to a different profession, and until another job is secured, support with finding out what benefits one is entitled to so that at least some money is coming in if the loss of income is having serious financial consequences. Finally, I just want to end with one simple and important message. If you are struggling yourself or are helping others who are going through a tough time, do please reach out and get the help and support you or others need to get back to a place of good well-being. Thank you all for listening.
Thank you so much, Anish, for giving us that wonderful overview of what well-being is and what factors, internal and external, can actually affect it. So now we're going to go on to our third speaker. It's Dr. Rishi Galaiya. Rishi is a qualified medical doctor who's midway through his psychiatric specialty training. He has an interest in mental health and he's had it since university. He completed a BSc in psychology whilst he was at medical school. He particularly enjoys working with children and adolescents, and he does this professionally and through volunteering through the sector. So, for example, in Shishkunj, Rishi is quite well known. His special interest is in professional burnout and improving access to mental health for the Black and ethnic minority communities. So, Rishi is going to talk to us about the different types of mental health conditions. Rishi, over to you.
Thank you very much for that introduction. So my name is Rishi and I'm going to talk to you a little bit about some of the mental health conditions that are out there. So what are mental health problems to start off with? As has already been mentioned, mental health problems are problems in emotion, thinking, and or behavior. And all of these three things are very much interlinked. So if you have difficult or distressing thoughts, that's going to affect your emotions and it might affect your behavior and vice versa. However, having problems with your thoughts, your feelings can be quite normal and is quite normal probably for all of us. But it becomes a problem when the thoughts are more persistent, so they last for a significant period of time, or they're recurrent, so that they keep coming back. And we also think of these issues as problems when they start affecting people's ability to do things that they want to in day-to-day life. And mental health problems, or the term mental health illness or conditions, describes a range of different problems, just as physical health problems describes a range of different problems. And it's really important to note that mental health does not discriminate by age, by gender, by social status, ethnicity, or religion, or anything else. So some of the common symptoms related to mental health illnesses, I've listed a few here, and I'm going to refer to them throughout the rest of the talk. So what I'm going to be spending the rest of the next 10 minutes or so talking about are some specific types of mental health conditions. And there are, hundreds of different ones out there, and I've focused on a few, and this is going to be a brief overview of some of the symptoms related to them and how to spot them. And it's also important to note that people who are suffering from mental health problems or difficulties may not have a specific condition, but it doesn't mean that their problems are any less serious and that they do need help. So I'm going to start off with depression. Now, everyone occasionally feels low, but these feelings are usually fleeting and pass within a couple of days. But in depression, you're not just sad or upset. It's an illness, and depression is where you have an intense feeling of persistent sadness, accompanied with things like helplessness or hopelessness. There are physical effects such as low energy, problems with your sleep, even having physical aches and pains. And people who suffer from clinical depression can be simply overwhelmed. And it can also be overwhelming for the people around them. So how might you spot depression in someone around you? So what I'm going to do here is just maybe speak about a few sort of rules or thumbs or questions to ask. And this isn't all encompassing, but hopefully will give people an idea. Do they seem irritable? Are they snapping back at you or not wanting to talk to you? Do they seem a bit withdrawn, lazy, different from how they normally are? Are they not engaging in activities, maybe household chores that they might normally do, or hobbies that they enjoy, or going out to meet their friends and family? Are they not sleeping or eating well? And this could be both sleeping too much or not enough, and eating more than they would, or having a reduced appetite. And people who are severely depressed will often have such low appetites that they might even simply stop eating. And this last point I put there because it's quite important, because I suspect most of the people listening will have felt some of these things either in themselves or people around them. And if there are any maybe parents of teenagers out there, you might recognize all of these things in your child. And that's actually probably quite normal. But when these things are new or they start to become excessive, that's when we need to start thinking if someone needs some support. I'm now going to talk a bit about anxiety. And anxiety is a very broad illness, and there are lots of sort of different types and subtypes. But anxiety itself is a feeling of unease, such as worry or fear, which can be mild, moderate, severe, and is actually quite normal if an unpleasant part of all of our lives. And it affects us all in different ways at different times. But while all of us will experience normal or healthy anxiety, some people find it difficult when the anxiety starts to actually control their worries, and they start to experience more constant levels of anxiety that affect their daily life. So what are the symptoms of anxiety? Well, the way I like to think about them is splitting them into physical or bodily symptoms and psychological or symptoms of the mind. And in terms of the physical symptoms, things you might feel are your heart racing or beating irregularly, butterflies in your stomach, odd sensations in your body, feeling restless so you can't stop fidgeting, sweating, not being able to sleep well, even feeling nauseous. And in terms of the psychological symptoms, things you might experience are feeling tense, feeling on edge, not being able to relax, having this sense of dread or this sense of doom that something bad is just always around the corner. We know that anxiety is very much related to depression and low mood. And some people who suffer from anxiety report feeling disconnected from themselves or the world around them. So for example, they feel like time is speeding up or slowing down, or that they're having an out-of-body experience. So the next one is addiction. And an addiction is the inability to control the use of something, or an inability to stop engaging in an activity despite knowing about its negative or harmful effects. And we commonly think of addictions in terms of drugs, alcohol, smoking, gambling. But actually, you can probably be addicted or have addiction-like behavior towards a whole host of things. So for example, the internet or social media, our mobile phones, gaming, shopping, and many more examples. And addictions can be really quite dangerous, actually, because they lead people to really desperate measures to fuel what they want to do. How might you spot an addiction in someone? Well, I think it's probably quite useful maybe to take an example, and I'm going to take the example of alcohol. So is this person maybe drinking more and more? Are they spending more time drinking? Are they spending more money on it? And when they start drinking, does it seem like it's difficult for them to stop? Have they stopped doing other activities that they used to enjoy so that they can go and have a drink? Do they seem to be avoiding you or behaving secretively? Do they seem anxious or stressed when they haven't had a drink for a few days or even a few hours? Or do they need a drink to stop them from getting stressed? And is it interfering with things that they want to, could do, or should be doing in their day-to-day lives? I'm quickly going to talk about eating disorders, and this is a really huge topic. So this is going to be a very brief overview, but I think it's important because it's one of the things that's maybe not so acknowledged within our community. And an eating disorder is a specific medical diagnosis for people who have difficult eating patterns that is both caused by and affects their mental health. And these eating patterns can be so severe that it will affect their physical health. And we know that, unfortunately, eating disorders is probably the highest cause of death in terms of mental health illnesses out there. The two main forms of eating disorder that you may have heard of are bulimia and anorexia, and there are a few others, but I'm just going to briefly describe or explain what these two conditions are. Those who struggle with bulimia engage in what we say are recurrent episodes of binge eating. So they start eating really large amounts of food in very short spaces of time. And sufferers of bulimia describe feeling that they just couldn't stop eating. They couldn't control themselves during these binges. And afterwards will often feel very guilty or ashamed about what they've done. And we know these sort of binges are associated with sudden change in emotions, including feeling very low, feeling anxious, feeling lonely, as a few examples. And following those binges, people suffering from bulimia will try and purge their food in order to prevent weight gain. So, for example, they may vomit up the food they've just eaten, they may use laxatives, or they may exercise excessively. Anorexia is slightly different, and people who suffer from anorexia restrict their food intake such that they reach a very low body weight. And people who have anorexia tend to be extremely scared of putting on weight. And they have what we call is a distorted body image. So although they have, very low weights, and to those around them, it can often be very obvious that they're underweight. To the sufferer themselves, it's not obvious, and they will continue to lose weight or stop putting on weight. Now, the last mental health condition I'm going to talk about is psychosis. And you might have heard this word psychosis, or the term psychotic used as an insult. But what actually is psychosis? Well, it's a mental health condition, and it's where someone starts to lose touch with reality. And in particular, they start experiencing things that aren't real, or believing in things that aren't real. And one of the common symptoms that people who suffer from psychosis have is hearing voices. Now, these voices, it may be a single voice or multiple voices, and they will talk about this person or to this person, and often in a very negative or distressing way. And the person who's suffering from psychosis will simply not be able to distinguish these voices from the reality or the real people around them. People with psychosis also start developing and holding on to false and often very bizarre beliefs. Examples of this might include holding special powers, or thinking that they are a famous person or related to someone famous. Other examples include what we call paranoid beliefs, where someone will think that they are the target of a conspiracy, or that someone's spying on them or out to get them. And they will hold on to these beliefs despite there not really being any evidence to support what they think is happening. And unfortunately, people who are really unwell with psychosis will eventually, those beliefs will become all-encompassing and just simply rule their lives. And psychosis can actually be a part of many mental health illnesses. For example, depression. In depression, people may hear voices and they may start believing that they're already dead. And a couple of other illnesses where psychosis is a key part are bipolar disorder and schizophrenia. Now, the last thing I'd like to talk to everyone about is self-harm and suicide. And I know this might be a bit of an upsetting topic for some of us, but I do think it's important to mention. Both self-harm and suicide are symptoms of mental health conditions, but also you can have thoughts or acts of self-harm and suicide without having a specific mental health condition. So what are some of the risk factors? So we know that most people who attempt suicide will have some form of mental illness or mental health condition, including all of the ones that I've just mentioned. Some might have physical illnesses such as chronic disease or pain that is very difficult to live with. We know that people who self-harm are at a hugely increased risk of suicide. And some of the external factors that Anish talked about also play a role in suicide. And we know drugs and alcohol are also an important factor. Why do people self-harm or have thoughts of self-harm or attempt suicide? Very difficult question, very difficult to answer, and often we just don't know. What I've put here are a few quotes from my practice, having spoken to people who have self-harmed or attempted suicide. And some of the things that they might say, it eases the tension to get relief from their thoughts. And what that means is their mental health problems were so severe that they harmed themselves because it gave them some relief from those distressing thoughts and emotions. People might say, I wanted to die. There was no other way out. And some people are unfortunately so unwell that they're just hopeless, and this is the only thing that they can do. And some people might say, I didn't know who to turn to. They're so distressed and they wanted help, but they didn't know how to get it or where to go. I'd like to end on this quote. To anyone who sees darkness, I would like to say that you are not alone and that help is always available. So for anyone who has recognized something that I've talked about or any of the speakers talk about today, either in yourself or maybe someone around you, then please do keep listening to our next speaker, who's going to be talking about some of the support that's out there and how to access it. Thank you.
Rishi, thank you so much for giving such a wonderful overview of the different mental health conditions and explaining it so well to everyone. So for our audience and for our viewers, have any of the things that Rishi has talked about raised any questions in your mind? Please do ask your questions on the comment section, which is just below the screen on the YouTube video. For those of you who would like to do it anonymously, we are going to put a link up just now where you can go into a form and ask your question. No one will know who's asked it, and we'll put it to your panel in the question and answer. Also, for those of you who want other information, in the description box of the YouTube video, we've put a link up. And on that link, it goes to the One Jain webpage for mental health. There are contacts for a range of mental health charities and organizations where you can access help. Okay, so we're going to go to our next speaker now, because we've talked about the different mental health conditions that Rishi has gone through so in such a clear way. Our next speaker is Dr. Chirag Gorasia, and Chirag is going to talk about how you get help for yourself, how you help others, and how you stay well. So let me tell you a little bit about Chirag. Chirag is a clinical psychologist and has over 15 years of experience, including working with children, adolescents, families, adults, and people with learning disabilities. He's also worked in some of the country's top hospitals, including Great Ormond Street Hospital, Birmingham Children's Hospital, Chelsea and Westminster Hospital, and Guy's and St Thomas's in London. He also works privately on Harley Street and regularly works with community groups and charities. So, Chirag, over to you now.
Thank you, Rajvee. So my name's Chirag and I'm a clinical psychologist. And what I want to talk to you about today is about how you get help, how you help others, including your loved ones and friends, and how we can stay safe in the current climate and the current pandemic. So, as with anything in life, getting help always starts off with a conversation, right? And, you know, for all of us, our friends and family are always going to be there, hopefully, to offer a listening ear and provide us with support, right? But sometimes that might not be enough, and we may need to seek professional help. And I'm going to talk a little bit about how you access services today, right? But what I would like to start by saying is that there is a lot of stigma, as the other speakers have spoken about today, with mental health in the Indian community and in the Gujarati community as well. And I would just urge people to not feel afraid about getting professional help. It's good to kind of have the family support, but it's also important that we do get people to access the professional help when they need it as well. So, prior to getting professional help, there are a lot of self-help books and guided self-help books out there, which you can buy from most bookshops, and Amazon is a great place to get these things. If you are going to use guided self-help and self-help books, then it's really important that you choose a book or a source that is a trusted source. So that means that actually, checking out who the author of the book is and checking what their credentials are as well, right? Guided self-help is a great way of doing some early intervention, and it can often supplement the psychological therapy that you can receive through professionals. It's also a great thing to engage whilst you might be on a waiting list somewhere as well. And there are lots and lots of different self-help texts out there. But I just wanted to highlight the Overcoming range, which has a number of self-help books for a lot of the more common mental health difficulties that we've talked about today. There are also some books around mindfulness, which is a very popular method at the moment. And there are also books like the Breaking Free from OCD book, which are aimed more at parents to support their children with mental health difficulties as well. In the 21st century, we also have the smartphone, and there are a lot of apps out there as well, which are really helpful to use as a first base, and even just for general everyday help as well. So there's Headspace, which is a great source for managing stress. There's Sleepio, which helps people to manage sleep-related difficulty. And there is also Calm Harm, which helps people manage urges to self-harm. And then there's something called computerized CBT. And one of the popular computerized CBT programs is a program called Beating the Blues, which is designed to help people with depression and low mood. Okay, but we've tried all of these things and that still doesn't work for us. So what about getting a referral to see someone professional? So what we do is we would try and go and see our GP and try and ask them to make a referral for us to see our local talking therapy service, which is also sometimes called the Improving Access to Psychological Therapies service. And sometimes also kind of abbreviated to IAPT. Some local NHS services will accept self-referrals, so what it might be worth doing is just doing a little bit of a Google to see what talking therapies are available through the NHS in your area, and most of them will have a website or a landing page which will tell you how you can access them. For children and young people and university students, there are a lot of in-house counsellors and school therapists that are situated in a lot of schools. So it might be worth just seeing what's available at your school, college, or university and seeing if you can access help through that as well. And for those of us in the world of work, a lot of occupational health departments now are investing a lot of money in employee well-being. And they also might be able to provide some support as well. Outside of the NHS, there are a number of great charities out there, and unfortunately there are so many that I don't have time to go through each of them, but what I thought I would do is just tell you about some of the main ones. So we have Mind, which is a great charity that advocates for mental health, and also in some areas it also provides talking therapy as well. So worth kind of checking them out. Then we have Young Minds, which is a great mental health charity that provides support for young people and adolescents. Something that we haven't talked about today, but which is another huge taboo in our community, is Alzheimer's disease. And the Alzheimer's Society is a great place and a great charity to go to for support around Alzheimer's and dementia-related difficulties. Rishi's also talked about substance misuse and addiction, and the Frank helpline, talktofrank.com, and the telephone numbers there as well, is a really nice website and resource to get some telephone support if you're struggling with addiction, particularly around substance misuse. Another difficulty that we haven't talked about today, and then maybe we can talk about this at a future event, is autism. And the National Autistic Society do some fantastic work in supporting people with autism and providing resources for not only people with autism but also their families as well. And lastly, a charity that's very close to the work that I do is BEAT. BEAT is a great charity that supports people with eating disorders, and they also have a number of resources on their website, as well as BEAT accredited therapists as well. So definitely worth checking out these charities. I should also highlight that in the comment section, there is a link to some other services via PDF. So please do check that out as well. Okay. But what if we can't access help through the NHS or through the charity sector? Well, there is always the option of going private. And obviously, with private healthcare, you can often access help a lot quicker than through some of the other services. And I should also remind people that a lot of us may have private medical insurance through our employers, or even just separately. And a lot of private insurance companies do provide cover for mental health. And it might be worth just seeing, if your insurance provider does provide that, and seeing if you can access help through that. When you are choosing a private therapist, it's really, really important that you do your homework. The industry around therapy is regulated if you seek the chartered therapist. So like myself, I'm a clinical psychologist, and I have to be registered with the Healthcare Professionals Council, which is the HCPC, and they regulate clinical psychologists and counseling psychologists. Rishi is a psychiatrist, and most medical professionals are regulated by the GMC. And for psychiatry, you also have the Royal College of Psychiatrists as well. Now, I often joke and say that finding the right therapist is like finding the right pair of shoes. You have to find someone that fits with you and gels with you as well, right? So it's worth just trying people for a couple of sessions. And if after that time you feel that you're not clicking, then feel free to think about whether or not you may want to see someone else. Yeah. So what are the different types of therapy? The most common type of therapy that most people access is individual therapy, and it's exactly what it says on the tin. It's where you speak one-to-one with a therapist. You normally, in person, but in the COVID times, a lot of individual therapists work via video call, and some of them also provide other interactive services like web chat as well. So individual therapy is all about one-to-one work, and is normally the starting point for a lot of people. Then we have couples therapy, family-based therapy, and family-based interventions. Now, couples therapy is all about relationships therapy and, supporting people with relationships difficulties. Family therapy is another real great type of therapy, particularly with children and young people's services. We have to remember that we're social creatures as humans, and often, with one loved one having a health difficulty or a mental health difficulty, it does have an impact on the whole family. And, it's worth actually kind of seeing someone as a family through family therapy. And family-based interventions are the evidence-based treatment for anorexia in adolescents. But also there's a lot of growing evidence around the use of family-based interventions for conditions like psychosis as well. We also have group therapies and psychoeducational groups. So group therapies are often around having, one or two facilitators or therapists in a group, and also using the idea of peer support and people supporting each other. Psychoeducation groups are slightly different. What they are about is about educating people and actually skilling them up to manage things like stress and sleep difficulties, and sometimes even things like confidence difficulties as well. And I should also mention that there are medications out there that we use. The term we use is psychotropic medication, and the two main types of psychotropic medication that people will use are antidepressants and antipsychotics. Now, with antidepressants and antipsychotic medication, it's really, really important that you do follow the advice that your physician and doctor has given you, and that you actually complete the course. And if you are thinking about coming off medication or changing any of your medication regime, please do it under the guidance of a qualified clinician, because it does need to be done in the right way. Unfortunately, as Rishi's already talked about, there are times where people with mental health difficulties will hit crisis. And at times of crisis, it's really important for us as a community to know what to do and how to support people. But also, if we're in crisis ourselves, it's important that we know what to do. And so my plea is to you that if you don't listen to anything else that I say today, please just pay attention to this one slide, right? So if someone or yourself are having thoughts of suicide, or you're in some kind of mental health crisis, your first point of call is to go to your local accident and emergency department, where you will be given the help that you need, right? If you can't get to your local accident and emergency department, or actually someone is needing urgent help and you can't get them there, then please call 999. There are a number of people that can come out to support you, and can actually kind of get you to a place of safety as well. There might be times where you're feeling really low or really at risk, but may not be able to, call 999 or get to A&E. And these are three great resources for times like that. So the Samaritans do some amazing work at supporting people. And the number over there is 116123, and it's a free call number as well. So that's for adults that might be in some kind of mental health difficulty or may just need to speak through to someone. Papyrus is a charity for under 35s, and they provide support for people that might be feeling suicidal or at risk of harming themselves significantly. And again, their details are on the slide. And then we have Childline, which is another fantastic charity that does some amazing work at supporting children and young people. And the great thing that they have is they have a web-based chat, which is really popular with children and young people in terms of getting the help that they might need. And again, they have a free telephone number, which is 0800 1111. So please make use of those numbers. Okay, so coming back to supporting our friends and our loved ones, right? So here are some tips of how we might be able to support people that might be having some mental health difficulties or may just be going through a real rough time. So the first thing that we need to do is just to listen to them and be non-judgmental. Let them say what they need to say, and be patient with them. It might take them a bit of time to actually tell their story. Make time for them, right? So it's really important, if someone's telling you about something really difficult, that you're not distracted doing something else, but you're giving them your full attention. Build safe trust. So it's really important to have trusting relationships and making someone feel that they can trust you. But safe trust is about knowing when you might need to break that trust. And at times like this, where someone might be at danger, you may need to break confidentiality. And if someone is at imminent danger, then I urge you to break confidentiality and actually get the help that that person might need. It's really helpful to identify options for people and, signpost them to resources, but be patient with them, please, and go at their own pace. People may not be ready yet to access help, but actually with some support and encouragement, they will eventually get there. And remember to keep in touch. As with any health difficulty or anything in life, it's a journey, right? So just because you've held someone's hand and taken them to the door of help, it doesn't mean that actually that's where your work stops. You need to kind of support them through the work that they're doing, as well as after that as well. So you might offer to go with someone to their first appointment, or you may even offer to actually meet them for a coffee afterwards, not to particularly talk about what they talked about in their therapy session, but just to hang out and just to give them a bit of normality. Yeah. Support people with their care responsibilities. So, if we've got mums or dads that may have childcare responsibilities, can you offer to look after their child while they go and see their therapist or whilst they get couples counselling? It's a great thing to do, and you're doing your bit there. All right. As I said before, we need to think about our journey through mental health, right? And when someone has recovered, that doesn't mean that that's the end of their story and that's it, finished, right? We might need to just keep checking in with them, and you may need to think about whether they might need a re-referral. Sometimes people may not realize that they're slipping, and you may need to just say, well, maybe we should get in touch, or maybe it's time to have a review appointment. Please, please, please keep being there for people, all right? Sometimes just doing the simplest things in life and helping someone to hold on to normality is the most powerful thing that you can do. Okay, so I'd like to finish off just by thinking a little bit about tips for how we can support people to stay well. Right, and how we can stay well ourselves as well. So the first thing is living a balanced lifestyle. So that means trying to eat right, trying to exercise right, and trying to manage our levels of distress. Think about it as mind, body, soul. So do things that are really good for the mind, do things that are really good for the body, and do things that are really good for the soul. So I'll reiterate the point that Anish made, which is about religion and spirituality. If religion and spirituality gives you that man shanti or mental peace, then it's a great thing to do. Right. But remember that, when lockdown does ease and we can go to the mandir and the derasa and any other place of worship, well, that's really good. Not only does it kind of provide us with a sense of hope and to put our kind of, difficulties on a higher power, but it also provides that social thing, where a lot of people, grandparents, etc., go to the mandir and then they might, meet up with their friends and have a bit of a chat. That's really good for mental health and well-being. Maintain your social life, right? We're getting into the warmer months, and hopefully lockdown is going to ease as the months go on. So try and reconnect with people. We didn't get to celebrate a lot of the big festivals over the last 12 months. So as lockdown eases, try and actually meet with people face to face. Go around to people, have chai, have nasto, have those barbecues as well. I'm really looking forward to that when, the weather gets better and things like that. And look after your sleep. Sleep is so important for mental health and physical health. So if you're not sleeping right and you're not getting enough sleep, it will have an impact on both your physical health and your mental health. Remember that it's okay to say no, right? And people will understand if you say no, or, say that actually I can't do that today, but maybe I'll do it tomorrow. Or maybe, this is how I can help you. Or maybe you could ask that person to help you, right? learn to plan your day. And this is really important when you're working from home as well. Decide what time you're going to finish work and actually stick to it, right? It's really easy when you're working from home to work until the late hours. We're all guilty of it. But what you need to do is just be a little bit disciplined with yourself, right? And remember that it's important to have me time as well. And me time is about pursuing solo hobbies like taking up running, doing gardening or art. And for me, my me time is listening to music. Music is a great way of managing your health and your well-being. For me, music takes me to fantastic places and, gives me that escapism that I might need. And lastly, remember to be kind. Be kind to yourself, be kind to the environment, and be kind to others around yourself. And if we can all be kind, then the world would just be a fantastic place. And with that, I hand you back over to Rajvee Ben.
Thank you so much, Chirag, and actually to all of our speakers who've given such fantastic presentations today. And we've covered so much. So we are going to shortly go over to the question and answer session. For those of you who still have a question, don't be hesitant, don't be afraid. Just put it in the comment section and we will try to answer it. If you're worried about anonymity, you don't need to be. There's a little link that we're going to post up and it's in various places on the comment section. It's a form that you go into and you can post your question and no one will know who's posted it at all. So please do go ahead and do that. So to run the Q&A session, we have another one of our team from the Jain Health Initiative, and that is Sonali Sanghvi, who's going to moderate it. And Sonali is a pharmacist who's worked at UCL Hospital for several years before specialising in genomic medicine. She currently is working at NHS England as a pharmacy advisor in the genomics unit. And she's been supporting the Jain Health Initiative since December. Sonali, I'm handing over to you for the Q&A.
Thank you very much, Rajvee, and thanks again to all our speakers today. We've had some great questions coming in, so I'll get straight to the questions. The first one we've had is about a lack of sleep and how a lack of sleep may affect our mental health. So Chirag, perhaps I could come to you first on lack of sleep and how that affects our mental health.
Chirag Bhai, if you just...
Yeah, so as I was saying in my presentation, sleep is so important for mental health and well-being. And it's interesting because actually, when we are not feeling emotionally well and mentally well, we start to lose sleep. And a lot of my patients, when I see them, will kind of say, the first thing I'd like help with is correcting my sleep difficulty. So sleep difficulties are a two-pronged thing because actually a lot of mental health difficulties stop us from going to sleep, particularly things like anxiety and stress. But also, if we're not sleeping right and we're not getting enough sleep, then we're naturally going to be a bit grouchy and a bit irritable, and actually our mood is going to be lower as well. So do look after your sleep.
Thank you, Chirag Bhai. I'll come over to Rishi as well. Did you have any additional comments around the lack of sleep?
So I think everything that Chirag just said is completely correct. And maybe just to briefly mention a few things to help your sleep. So sleep is probably one of the most common things I see every day, problems with sleep. And the first thing I might tell someone is think about sleep hygiene. So if you're able to, just Google this word, and there's loads of different sort of leaflets out there, but it's just simple things like not drinking caffeine too late, not exercising too late in the day, but exercising early, having a routine before you go to bed, lots of different things, but that's something I suggest everyone does and just has a look at.
Great, thank you, good tips. So I want to come next to a question about children's mental health. So how can we support our children's mental health, particularly during the pandemic? And in particular, if we think that a child is having some problems, what can a parent or a family member do to support a child or a young person through these times? Varsha, perhaps I'll come to you first. I know you've got experience working with children as a teacher and in the mental health setting, so it'd be great to hear your views, please.
Thank you, Sonali. For children, one thing is that anxiety feeds, and especially children have missed so much school. They've been away from their friends, returning back to school, doing all this COVID testing at the moment. That is putting a huge stress on them. We talk about quarantine teenagers. Imagine, you're locked up in your room, and one thing you've had is your phone with you. So social media plays a huge amount of time. And as parents, we want them to achieve. So we are now conscious that missed school, will they get the grades? Will they be able to move on? So one thing I would say is actually simple things that you could do is take your children outdoors. Going out in the natural space, green spaces, and walking in those green spaces would adjust. And the green therapy is simple to do, but it's really, really effective. And the other thing is catching up on school, that anxiety. I think give them a space to just come back to normal, because anxious children are not good students. If you are really anxious, you're not going to learn really well. So create a home environment that's jovial, less pressure, because they're already feeling pressure on themselves. So just creating that space just to be normal is really, really important. And our families really need to focus on that. And for those mothers, I know some of you will, understand that this is a little bit more, because mothers have a sense that, the child is really struggling. So help is available. You can talk to your GP. Sometimes the referral time is long, but there are still a lot of things available, and there are lots of apps available as well. So if you look around, there is a lot of help available out there.
Great, thank you, Varsha. And I know that a lot of the links to the websites and the different resources that are available have been put in the chat and are on the One Jain website. So those are available as well. So actually, in talking about well-being and people's well-being, the isolation and the enforced isolation that we're all experiencing during lockdown has affected everyone's well-being to some extent, in particular maybe certain groups like children and the elderly. Anish, maybe perhaps I can come to you just to talk about sort of the impact of this isolation on well-being and how we can cope with that.
Okay, so I think the first thing to say, and I'm going to sort of dovetail with the end of what Chirag said, which is around being kind to yourself, and really as a platform for anything. If you're feeling these feelings of isolation and you're feeling depressed or anxious as a result of them, that's perfectly normal. It's okay to feel those feelings. I mean, what's happened with COVID, as human beings, stress is obviously difficult to cope with, but when something is unexpected, I mean, who could have predicted that we would have this kind of enforced isolation? Something unexpected will have a toll on your mental health. And kind of then just using that as a platform and moving forward from that, I would say that to maximize the resources that you have within the rules. This might sound like a simple thing, but within the government rules, for example, I believe we are able to meet with 1 or 2 people outside. So to take advantage of at least those avenues that are available, it's in my practice, and just when I work with other mental health professionals, when working with clients, sometimes these obvious things, especially when you're feeling depressed and anxious, just feel hidden from view. So take advantage of what is available. And also, when you're feeling depressed, lonely, anxious, all these kind of feelings based around isolation, what can start happening. And if you remember the example of Prakash that I gave, this like, I'm useless at everything, all of that kind of stuff, that's what we call global thinking, that it'll always be like this and it will never change and nothing will ever improve. And to try as much as possible, and if you need help with friends or family or even professional to do this, but to just kind of take a step back. So if we look at what's happening, the government and the powers that be are getting finally a better handle on COVID, the vaccinations being fully rolled out, the rate is dropping. And again, what Chirag said about kind of looking forward, we are able to meet people. Hope is such a powerful thing within mental health. So try and have that kind of hopeful attitude. And really, the final thing is something about gratitude. Now, I'm saying this a little bit tentatively. So when I mean gratitude, that's, for example, like, how we're all able to talk to each other, how we're able to have access to technology. So gratitude isn't about like, oh gosh, I should be so grateful that I have access to technology or things like that. But just the kind of gentle appreciation of, again, the resource that we do have. I mean, for example, as Rajvee mentioned, I used to work in charity in East London. I still keep in touch with them, and a lot of their sessions have gone on Zoom. But unfortunately, because of financial struggles, not everybody can afford the technology. So only half the clients are able to access it. So again, just those kind of resources around you, just to have that kind of gentle appreciation. But I would say, out of all of these points, the main one is to look forward with hope. Things are changing, things are improving, and just to think about a time when we will be able to all meet each other again, which hopefully will just perhaps even be a matter of months. Thanks.
Thank you, Anish. And a related question for Rishi actually is about, when we're going through these tough times during the pandemic, how do we distinguish between the clinical depression that you described and just coping with this pandemic and the situation that we're in? And in particular, if we're not meeting with people and we're only talking to people on Zoom, how can we know and use those signs that you mentioned around spotting depression, whether it is just the situation we're in or it is clinical depression?
So that's actually a really good question, and it's difficult to answer. So we talk about clinical depression, but there isn't a cutoff where if you're this unwell, it's normal, and then you're this unwell, you're now depressed. It's very much on a scale. So it's difficult to really see, and all I can suggest is checking in with people. So some of those tips that I mentioned, if you think maybe someone is going through something like that, then just check in and maybe ask the question, have you been a bit down lately? Do you feel a bit unwell? And see what the response is. And I think just be ready to offer support and help.
Great. Thank you, Rishi. So I want to come to a question that's come up a few times. And I think I'll come to you first, Chirag. You mentioned about how we can support friends and family. But what do you do if you are worried about someone, but they don't themselves recognize that there might be an issue with their mental health? So how can you support them or maybe convince them to access some support?
Sure. That's a really good question, and actually something that I get asked a lot as well. And I think, like with what Rishi answered, there is no right or wrong answer in this. And I think for you to be able to guide someone to get help, it's really important that you have a relationship with that person already. So this is why keeping in touch with people is so important. If you don't have those relationships, then you're not going to be able to help someone to go through that. But you have to think about the impact of that person not getting help. And there are times where actually you need to enforce that someone gets help, and that might be done in a number of ways. It might be that actually you get someone else from that family to join you in a conversation and actually kind of make a bit of a roadmap of what you're going to do to get that person to help, or actually, you do seek advice from a healthcare professional, and actually kind of see in that individual situation what can and cannot be done. It is very situation specific, but even just kind of saying, look, let's just go and see the GP and then see what happens, or maybe we'll just try one appointment and then see what happens, and take it one step at a time, be patient, and just be there, and you will get someone to help.
Thank you. And if I could stick with you, Chirag, and ask another question that's come up about actually connecting with services in a way that's sensitive to our own cultural context, and also connecting to services where we may want to access help in our own language, so in Gujarati or Hindi. Do you have any advice about how we access services in that way?
Yes, so a lot of primary care mental health services do have people that are multilingual. So, for example, when I work in services, I'm known as the person that can offer therapy in Gujarati. So that can be done. But we should also remember that actually there might be times where we may not be able to get someone that can help in our language. And at that time, interpreters can also be arranged as well. So it is there. And there are lots of resources available in multilingual formats as well. So most GPs and healthcare professionals can signpost you to those as well.
Excellent. Thank you so much. And I also just want to thank one of our team members, Khyati, who is a GP who is supporting with the question and answers coming in. So for some of the more personal questions that are coming in, Khyati is there to just signpost you to resources that are available. So I want to, Varsha Ben, come back to something that you described about being more open in talking about mental health, and sometimes within our community there can be, you mentioned some stigmas attached with just talking about mental health. How can we reduce some of those stigmas so we can openly talk about mental health struggles within our community and with our family?
I mean, let's face it, mental health has been a taboo subject for very long. We've had people who champion around mental health. So we had a time to change program, trying to address the stigma. But unless you and I can actually talk about it. So one thing I would say for everyone, get up to date with what's available in your local area about mental health, even simple things. There's something called mental health first aid, right? We talk about bandages and all that, and I learned first aid. But do we talk about mental health first aid? I mean, it's available in schools, it's available for communities. So this is something I would encourage. And I think as a society, if we believe that there's no health without mental health, then we should be able to kind of really be open with at least our family members. So instead of showing somebody aside and not valuing them, I think we need to create time for them. Because as Chirag said, unless you practice safe care, it's not going to happen. So it starts with our families first. Each of us getting better acquainted with what's happening about mental health and what services are available locally. And then there are support groups. There's an ECTA group in Harrow, just specifically for our community. So there are multiple options that we can pursue.
Thank you. So I want to come back to Chirag, please. You mentioned around some of the contacts that are available for people who are feeling that they're in a really bad place or going through a sort of crisis point. Could you just go over those messages again so that our audience knows where that they can go for those links and information?
Sure. So what should we do in an emergency? So I always say, remember dealing with an emergency in mental health is exactly like dealing with a medical emergency for someone that might be having a cardiac arrest. So the first thing you do is try and actually kind of get emergency help. And the way we do that is by calling 999. If you are able to take someone to their local accident and emergency department, please take them there. It is a place of safety. And I should also reiterate that just because you present at accident and emergency, it doesn't mean that you're going to get sectioned or you're going to be put onto a psychiatric ward or anything like that. We will always do our best to try and keep you safe and send you back home. It may just mean that you just need a review. Right. I should also emphasize that there are those 3 charities that we talked about. So there's the Samaritans, and just piggybacking on what Varsha said there, Samaritans do also provide counseling and therapy over the phone in different languages as well. So definitely worth kind of remembering that. Then we have Papyrus, which is for the under 35s, and they provide support for people that may be struggling with thoughts of suicide and self-harm. And then we have Childline, which is again a fantastic charity that provides emergency telephone help for children that may just need a little bit of support in managing distress. Yeah. And I should also say, sorry, that your GP is always going to be there as well. So if it is something that is less emergency but more kind of acute, then do make an appointment to see your GP and tell them that you need to see them urgently.
Thank you very much. So we have a question here about emotional communication. So Anish, perhaps I can ask you about what is the importance of us communicating our emotions, and does that help us keep up our mental balance and well-being in being open in the way that we communicate our emotions?
Yes, as a broad answer, absolutely. Communicating about our emotions, it helps us process the emotions. So actually, if we look at the therapeutic perspective, so many clients forget any intervention work just from having that space to talk about what they've been bottling up, that release that they feel, that sometimes actually feels like even half the work. So talking about what's going on for us is massively important, and it does help us process the emotions. Sometimes through talking about it, you're able to, as you hear yourself verbalize it, you're able to get that perspective on your emotions as well. As Chirag mentioned, there is the kind of friends and family route and the therapy route. In an ideal world, we would all have friends, family, where we can talk very openly about our emotions, about mental health. Unfortunately, we're not quite at that stage yet. So that's where never be afraid to seek a professional help, outside support. It's not a sign of weakness. If resources you have around you don't allow you to have those conversations with those in your social and family networks, do reach out beyond that. Yes.
Great, thank you. So we've talked a little bit today about sort of the link between physical health and mental health. And Rishi, I wanted to come to you with a question about sort of when we are starting to look at mental health changes, often we think about thoughts and emotions. But are there also some physical tests, things like blood tests or hormonal tests, that can also help to diagnose what a mental health condition might be, or whether it might be more linked to a physical health condition? So I think an example someone's given is something like menopause, which can go undiagnosed or could link into a mental health condition.
Yeah, that's a good question, and maybe something we should have talked a bit more about, actually. So we know that mental health problems and physical health problems are very interlinked. And we also know that some symptoms of physical health problems either mimic mental health conditions, so some of the ones that I mentioned in my talk, or cause mental health conditions. So often if you go to your GP with certain symptoms which you think are related to your mental health and which are related to your mental health, they will often suggest you have some routine blood tests. And what they're looking at are things like your blood count, maybe some of the hormones in your body, some of the vitamins and minerals in your body, because we know if some of these are too low or too high, they can mimic or cause symptoms like anxiety, feeling low, and things like that. So often your GP or your psychiatrist or another doctor will recommend having a blood test or even having a scan of some sort. And that's usually because they're trying to work out what's the real cause so that they can give you the correct and the best treatment.
Thank you very much. So I'm going to come back to Chirag about some of the support that you described. So one of the questions is about the private access to private services and whether you need to have a referral from the GP to go and access either private services or through private health insurance.
Okay, so that's another great question as well. So the truth of it is that if you're accessing private healthcare yourself, it really does vary if you're going through health insurance and what your health insurance provider may ask for. So some health insurance providers do ask you to see a medical professional first, like your GP, or they may even have an in-house GP that triages and then provides support. Certainly, a lot of the services that you may contact directly, and my one included, does not require a GP referral, but please be aware that your therapist or your psychologist may ask you to go into your GP for some things, but they also might ask you to see a psychiatrist like Rishi to get some other advice around medication and that sort of stuff. So you don't always need a referral from your GP, but it does vary from insurance company to insurance company.
Thank you. Varsha, can I ask you a little bit about, I know there's a huge focus, particularly in the NHS, around prevention. So what do you think are some of the ways that we can prevent mental health and prevent ourselves from developing mental health conditions?
So we've talked about what keeps us well, what are the protective factors, a good family, social life, good sleep. And I think one lesson that I've learned today is really focus on sleep, because we are burning at both ends. And I'm guilty of it. I do my WhatsApp messages just before I go to bed, so because that's the only time I get. So developing this good sleep hygiene. Sometimes if you have a long-term condition, some people with diabetes or whatever really need to be also kind of looking at mental health. And, in the NHS, what we've got is physical health and mental health, and not always joined up, right? So somehow, like the patients or the carers, they need to join it up. So by looking after your mental health, you're looking after your physical health and vice versa. So prevention is about focusing on both, right? And lastly, contentment and giving back. Yeah. What really energizes us? Because that will keep you well mentally. So just think on what gives you pleasure, because we all need pleasure in our lives. What makes you fulfilled? If it's a job, whatever, you spend so long at work, there are times when we just need to have a balance and refocus our energies if things are really dragging us down, and kind of have a checkup on ourselves and our family members and be able to talk about it. I think those are kind of the preventative measures that we can all take.
Thank you. So one area that we didn't directly speak about, but that I think it would be helpful just to maybe talk about a little bit more, perhaps Rishi, you could come in on this, is around postnatal depression. So how do we how do we sort of signpost around postnatal depression? How do we detect it and support people who may be suffering from postnatal depression?
So the short answer would be just as in any other person who's depressed, the steps would be the same and the symptoms are pretty similar. I guess the only maybe specific things to add are that people who have recently had a baby will often feel low, and that's actually really quite normal. And there's this concept of the baby blues, which again is a real thing, and it's quite normal. But at the same time, for some people, their low mood or their anxiety or their other symptoms can actually be a real clinical depression. In terms of getting help, I think all of the things that we've already mentioned, reaching out to people around you, going to your GP or your midwife or your healthcare visitors, they're all trained to actually spot some of these things, and they will all know how to offer you help.
Thank you. So I want to come to a question for, sorry, just scrolling here. A question around teenagers. So how do we support teenagers? How do we distinguish whether they are, I think as it was put, just being a teenager, or whether there are sort of underlying issues that we need to support them with, particularly if they're not communicating? Perhaps, Varsha Ben, I can come to you on that question.
So 3 things I'll look out with teenagers is, one, there's this perfect body image, and the social network they have. And we are finding that more and more teenagers are having their body image and the way they eat and the way they drink are really difficult, and especially in the lockdown. So just we need to really inculcate within them that they are beautiful. But for teenagers, this is really important. They're also going through hormonal changes, and within the hormonal change, puberty, that has its own challenges. So really be understanding and support them, because that phase is real. And thirdly, the pressure. I mean, we are quite competitive, and we want our teenagers to do as well. But I think we need to understand that each child or a teenager have their own wishes and aspirations and think what they're good at and not good at. There's social media pressure on them. When I was growing up, I didn't have that social media pressure. So how do we actually get them to be more savvy? And this is where we as parents have to understand the way internet and social media plays a part. And one thing, each one of us, is what do we post online? Because sometimes you may have posted images online and then you're really worried about that. And teenagers get into this acting very rashly, not quite sometimes understanding the consequences of it. So their friend circle, what they're doing. So it's a what I call climbing a hill, a pedal on the clutch and a pedal on the brake, and this is what's really difficult. And I wouldn't want to be a teenager today with the pressures it has. So I think we really need to be understanding, and help them, be their best friend, guide them, be the backstop. Really be the backstop for whatever they're going through.
Thank you. I'm going to come to a final question now, I think, as we start to wrap up the program. And Anish, perhaps I can come to you to ask, at the moment, it feels like there's a lot of triggers around our well-being. We're seeing a lot of issues in the news. There's, I don't know what others feel like, but I feel like I'm constantly scrolling through different news screens, and that I want to ask you about how we can work to cope around these specific triggers for us that may be around the news, it may be around issues with racism that are going on, it might be issues around access to healthcare at the moment. Do you have any advice about maintaining our well-being in the current situation?
Yes, so that's an interesting question. I mean, triggers are far and wide, like you just mentioned. I think see, with this kind of question, it's about getting in the information and finding out what's going on around us. But I really think on the most practical level, there's also something about limiting our exposure from a mental health point of view. So if you're reading the news and it's just getting too anxiety provoking and it's just not good for your mental health, quite simply just stop reading for a day, take a break, because none of us are impervious with the information that's going on around us. When we just see something on TV casually or whatever it is, it does influence how we think and feel. So just be mindful. I think the term that I've heard is almost to kind of go on a kind of TV diet or a news diet or something like that. And those kind of practical solutions can be quite helpful. And really beyond that, in terms of triggers, I mean, if there is something triggering our mental health, if we can find a way of dealing with it, either through getting support or doing kind of our own reading research, then that's obviously great. But some of the things that you mentioned, Sonali, about what's in the news, these are things way beyond any individual's control. And then it is just about how we take care of ourselves, how much information we take in. There's a lot of rightful kind of celebration of us being in the information age, but we also need to be careful, because with multiple sources of information that come in, before we know it, it can have an impact on well-being. So just to be measured, I'd say around the information that we take in.
Thank you so much, and thank you for all the responses to these many questions that we've had in. Some really helpful advice about being kind to ourselves, about the support services that we can access, how we can spot when we need that help, and how we can support ourselves and our loved ones. So I think it's been really excellent. Thank you. And I'll pass back to Rajvee at this point.
Thank you so much, Sonali, and huge thanks to our panelists, who not only gave absolutely superb presentations, but handled the questions so well with clarity and lots of information. As I've said before, if any of you want to have access to any further information, please go to the One Jain website /mental health. There's a link in the description box as well. If you would like to give us some feedback to our session, we really like to understand how you found it, how you found the presentations, the length of it. There is an email address we're going to put in our comment section. It's health@onejain.uk.org. Please do give us feedback on how we're doing. I'd also like to thank not just the people that you can see on screen, like myself, Sonali, and the speakers, but also we have a triage team in the background helping to sort the questions. So Suraj and Raj, we've got a fantastic web and Zoom team on today. So Anish and Kumar. And also we've got a fantastic team of health colleagues and a leadership team. And finally, thank you so much to One Jain to help organize these events under whose umbrella we're doing all of this. Our next event is going to be on Sunday the 11th of March. So we're going to be doing an event every month. So the next event is going to be in Gujarati. It's for our slightly senior, older people, because the topic is balance and aging, preventing and treating falls. So if you are someone, or you have a parent or grandparents who you think would benefit, or you know someone who's caring for someone who needs help with these issues, then please do dial in, and you will get information about it shortly. There'll be more information on the One Jain website. So with that, I'd like to leave you all. I hope you all have a wonderful evening. Jai Jinendra, everyone.